Hi, my name is Dr. David Lott. I am a surgeon at the Mayo Clinic, and I am here at the Mayo Clinic Symposium for Regenerative Medicine and Surgery, and just got done speaking about some of the things that my lab is doing in different regenerative medicine techniques. And I am a laryngeal surgeon by training, and that focuses mostly on airway reconstruction, on cancer, voice rehabilitation, and swallowing rehabilitation. In addition to that, I am the director of the Head and Neck Regeneration Program within the Center for Regenerative Medicine. And what I was speaking about today was some of the work we've been doing with regenerative medicine specifically for the larynx and the structures of the voice and swallowing. What we're doing from that standpoint is a big problem with operating on the larynx is that it's a highly unique organ in the fact that it governs your ability to breathe, your ability to protect your airway when you swallow. So food, a lot of you guys have had food that goes down the wrong tube. Your larynx is what protects that from happening. It also obviously is responsible for your ability to communicate with one another. And that's what most of my patients have the biggest concern about from a quality of life standpoint, is the ability to communicate and to express themselves in a way that shows their personality and who they really are. And a lot of people feel like they lose themselves when they lose their voice. And so the ability to properly reconstruct the larynx and restore those vital functions has a huge impact on people's quality of life. In addition to quality of life, these reconstructive efforts can also be life-saving in the fact that a lot of the cancers that we have to remove are severely disfiguring, and sometimes we can't remove the cancer because we can't have a way of reconstructing the larynx once it's removed. And again, the larynx, when I talk about the larynx, that's the voice box. And the voice box itself has the vocal folds in it, and it's in your Adam's apple area here. So we're talking mostly about this area here. And if you have an area that you can't reconstruct, you can't remove cancers from that site, and then people have sometimes don't make it from their cancers simply because we can't reconstruct that off area. What we're doing in our lab is looking at different ways to either transplant the larynx, like you would think of a heart transplant or a kidney transplant or a lung transplant, where you take it from one person and you transplant it to somebody else. That requires immunosuppression. And immunosuppression has a lot of problems that go along with the medications. But you also can't do immunosuppression for patients that are newly diagnosed with cancer and aren't considered cured from their cancer. So that removes a lot of the ability to reconstruct that we want to for that specific population of patients. The other thing that's coming out in science now is tissue engineering and the ability to regenerate different tissues based off of the patient's own cells. So what we can do is we can use stem cells from people's fat. You can actually get stem cells from many areas. Our lab uses stem cells from people's fat. We can use a 3D printer, and we can specifically look at the area we want to reconstruct based off of a CT scan that we reconstructed in 3 dimensions. And we see exactly what the surgical defect is going to look like, and then know what we need to do to reconstruct that. So the software, we can then reconstruct that area, get it exactly how we want it to be, get the vocal fold in the proper position, and make it a perfect match for that person. And we can print off that scaffold. Once you print off that scaffold, you can add then the stem cells and other growth factors to help those cells differentiate into the type of tissue that you want. So the main goal really is to be able to get a patient-specific reconstructed, or a patient-specific implant for reconstruction that has their own cells and is on the way to growing the tissues they need, so that when you remove the cancer, you have an ability to go ahead and put in their specific implant that then allows for a function of the vocal folds. And again, that mainly allows people to swallow without aspirating, allows people to breathe without having to put a trach tube in forever, and allows people then to get their voice back. Although it may not at this early stage be a perfect voice, it's a functional voice, so people can communicate with one another and be able to share their personalities and talk with their loved ones and all the things that you think of as you that comes out through your voice.
Thank you. How new is using a 3D printer? and is it an effective method of treatment?
It is. So 3D printing, that's the technical term for 3D printing is called additive manufacturing. And that process has been around for quite a while, so years and years. I honestly don't remember the specific date, but I know it's been around for many years. The adaptation of that technology to healthcare is a relatively new concept, and it's gone through many iterations. And the first way it was used in medicine is to make specific molds for operative planning for patients. So if we need to reconstruct a jawbone or ribs or something like that, through the same CT scan process, you can get a 3D reconstruction of what it is, and you can see how you need to reconstruct that area. Patients that have big tumors that are in very difficult areas to get to, you can print that off in 3 dimensions, and that allows the surgeons to go in and figure out their approaches and figure out the best way to safely remove that tumor. So that was kind of the first iteration. And then as the technology has advanced over time, there are printers that you actually can print off the material, can print off specific material, you can then implant into patients. And that's another process. It has to be done in a clean room environment, and there's a lot of steps you have to go through that. But you can take those 3D printers then, and then print that off specifically for your patient. So that process is still relatively new, and there are a lot of different bugs to be ironed out about that. But again, the nice thing about the 3D printing is it allows you to do a specific implant design for that patient. The downside with that is that it's not the cell's native environment. So you're having to try to print something off that as closely mimics what that cell would be living in the body. But that's very, very difficult to do from a 3D printing standpoint. And so that's where a lot of our efforts are now, is how do you best mimic the natural environment with 3D printing.
Thank you. We have a question from Facebook. This is groundbreaking. Is it still available for patients now, and where?
Sure, yep. So we are in the process right now working with the FDA. You have to go through, obviously, the FDA processes for that. And they consider any technology with stem cells as a new drug. So there are many routes you can go down. And so, but we have to treat this like any pharmaceutical company would in trying to get a new drug out to patients. And we are in the process now of actually initiating a clinical trial with the FDA to be able to do this. So there isn't anywhere that's doing that currently, but we're hoping by mid to late 2017, once everything's ironed out with that process with the FDA to make sure we can do this safely for people, and it'll be available then.
Thank you. And one final question. We're here at the Regenerative Medicine Symposium. What are you personally most excited about in the space of regenerative medicine? You know, what do you see coming down the pipeline that you think has real potential?
Yeah, that's a difficult question to answer because it's such a wide field. Regenerative medicine really incorporates everything from well, let me take one step back. The 3 basic tenets of regenerative medicine are the cells that we use, the scaffolds that we use, and the regulatory or bioactive factors that we use. And you can use those in combination or by themselves. And so you have the ability to just use cells or just use scaffolds. And that's where the amazing part of this is. It's such a new area in science that we don't really know what we don't know yet. We know how to safely then try to apply this to patients, but it's wide open. But I do see this as a new area in reconstructive surgery for patients. So it really kind of unties our hands a bit as surgeons on what we can do to help save people's lives, because we now have these options to better reconstruct these defects. And so that's what I'm, I guess, most excited about, is that finding out what doors are going to be open for us in the future as we continue to go down this road.
Great. Well, thank you so much.
You're welcome. Thank you all for watching.